I knew it was serious. However, what I did not know truly is the severity of it. The doctor had told my daughter if she would not have gotten me in, I would have been dead in 12 hours. I've been in Indiana my entire life. I went to school at Purdue University and then came back and raised my family here in Valparaiso. I really like traveling for work. It provides me opportunity to see things I normally wouldn't. I get the opportunity to hike and I get to meet great people. When I'm out hiking and I'm in nature, it allows me just to appreciate what's around me. April 1st, I started to have mild symptoms, a little bit of shortness of breath, but nothing major. My doctor thought it was either allergies or possibly a virus. She put me on antibiotics and prednisone. I started to feel a little bit better, but I never was quite 100%. All of a sudden, I started to have major back pain and extreme difficulty breathing. Shortness of breath was excruciating. Woke up that next morning to use the bathroom, and my daughter found me in the bathroom passed out. Went to see my doctor. He said I had a massive clot in transit in my heart and massive pulmonary embolism. I knew it was serious, and I needed to call and tell my husband a potential goodbye. I said to him, honey, I don't know what's going to happen. I'm going to go into procedure, and the doctor said I should be fine, but if I'm not, I need you to take care of my babies. Make sure that Connor goes to college. Make sure that Adriana, that you walk her down the aisle and that you tell her I love her, and just take care of my babies.
Jessica came to us. She was a case of massive PE and had significant right heart strain. When I saw the CT scan and also reviewed the echocardiogram, I was very surprised to find that she also had a massive clot in transit. At the time, we told Jessica that the options are limited and we had to take her to the cardiac cath lab to remove the blood clots right away.
To go from thinking you're coming in for something as simple as pneumonia to turning in that you need emergency procedure in a matter of just a couple hours is quite an emotional roller coaster.
When you have a clot in transit, the options are really limited. Luckily, at the time, we had access to the Inari flow retriever in our hospital. With significant ease, I would say, I was able to extract the clot from the right atrium. And from there, we extracted the clot from the right pulmonary artery on the right side and then on the left side. We had significant amount of clot extraction. And Jessica suddenly looked up and said, "Doctor, whatever you did made me feel so good, I can breathe now." This is a game changer in my book. Within 24 to 48 hours, patients can be discharged and there is no ICU stay.
To explain that when you have not been able to breathe adequately for 5 weeks, and now all of a sudden you remember what it's like to fill your lungs with air, it was probably one of the most phenomenal experiences, like a body experience to me. Because it was like, oh, I can breathe again. This is what it felt like to breathe. This allowed me that opportunity. The Inari procedure allowed me the opportunity to be out and living my normal life in a fraction of the time that I would have if I would have had open heart surgery. I went back to, within a week, walking my dog. I've started hiking again. I'm running again. Having this, what I would call second chance at life, has made me kind of appreciate all the things around me. I can't take any of the days for granted.